I'm Paul Watson from Newcastle University in the UK, where I direct the UK's National Innovation Centre for Data. Today I chose a topic of how digital technologies can transform healthcare. Providing good quality healthcare at an affordable price is a real issue for many governments and citizens around the world. And one of the things I'm interested in, and people in the medical school at Newcastle University are interested in, is whether we can use modern digital technologies in order to give patients better health outcomes at a reduced cost. And one of the ways in which we've been doing this is to use sensors to capture information about the way in which people walk, gait analytics. And we analyze this data in order to try to build predictive models which will help to identify a range of medical conditions as early as possible when they can be treated, and where treatment is less expensive than it would be if we waited until patients become very ill. And so examples of this are Parkinson's disease, multiple sclerosis, and lung problems. So today I've been speaking at IEEE Future Technologies, and this is an important area because what we can do is to think about how those technologies that are starting to be developed now but are going to come along in the future could make a real difference to people's lives. And so in the healthcare area, there's a whole lot of opportunities which people can work on. So one of them is, how do we build new sensors which allow us to pick up on medical conditions as early as possible, and that people can wear in their everyday lives, so that they don't have to wait until they get ill and come into a hospital before we can determine that there's a problem that can be treated. There are other exciting new developments in technology coming along. So I mainly work in data science, and so there's all sorts of new algorithms in machine learning and statistics which we can use to extract value from the data that we can collect from sensors. And this is value that we couldn't possibly have got from this data 10, 15 years ago. And there's some new developments going on in this area. So one of them, for example, is decentralized machine learning. So rather than collect lots of healthcare data into a central repository, can we actually store the data close to the patient and build predictive models for their health, which allow us to improve the quality of their healthcare, and to do that without centralizing the data? And this means that we don't have to worry about the bandwidth to upload all of the data to a central place, but also it can address the problem of security. So the danger if we build these large pots of medical information, what happens if somebody attacks those repositories and gets access to that information? If we can push the data to the edge close to the patient, then we don't ever have to centralize it. But a key question is, if we do that, can we build high quality models? So I've very much enjoyed the conference. I've learned some interesting new advances in technology that I didn't know about, which I might be able to incorporate into my own work. And I'm looking forward to coming back next year as well to find out about the work that people have done since this year's conference.